Talking Shop, welcome. We got Dr. Jason Castellanos today, good friend and a competitor as well. So, man, welcome. Thank you for coming. Thank you for being here. Tell me something about you.
Thank you for having me, bro. It's always nice to sit down with you. You're a smart guy. Anytime we talk health, I'm excited because you learn from me, but I also learn from you and we work together. So I'm excited to talk health,
For sure.
Talk chiropractic too.
Yeah, that's what we're here for. I wanna hear more about this chiropractic field. I have been around chiropractors before, like I got treated by you and other chiropractors, and it kind of seemed like it's physical therapy, but at the same time, it's a little bit different. So tell me, what led you to the chiropractic field, and what is it exactly?
Yeah, so it is different. It's not healthcare that your family doctor is providing you. But first let me start. I got into chiropractic because I was working as a weight loss counselor, helping people lose weight. I had a client who was in chiropractic school. Okay. Now, when I was working there, I knew I wanted to go back to school and do something different. I didn't see that as my final goal. So she told me, I'm in chiropractic school. I didn't know anything about chiropractic, so I decided to look into it myself. Right. Did some research. It's drug-free. So that really caught my attention, right? We don't prescribe. We're not handing medicine to our patients. Everything's natural. So that really intrigued me. And I did some research and it called my name. So what I did, actually, I went and tried chiropractic for the first time. I didn't have any problems. It was more like a wellness adjustment, you could say. Okay. But the changes I felt after that is really what intrigued me and what caught my attention to pursue it as a profession. Because again, it's different. It's drug-free. I wanted to do healthcare, but I don't like the medical aspect of what we consider healthcare right now. Right.
It's a business.
It's a business. That's a deep topic we can dive into if you'd like. But there's more to than just writing a prescription and handing the prescription over to your patient.
Well, it's crazy because actually last night I was watching this movie, Painkiller something, Pain Hustlers. It just came out. It's with Chris Evans, and I don't remember the main actor, the woman, but it's based on a true story about how
Andy Garcia's in that movie too.
Yeah, Andy Garcia's in that movie too. Yeah, it's super dope. So it's crazy that you talk about that because it is a business. The big pharma, and this is what they're talking. The whole movie is like the sales reps. They go to the doctors and they pay them an amount for them to write the prescriptions.
Yeah. They're incentivized to push certain medications and certain brands, right? And what I see it as, it's a lot of brands, right? Yeah. I learned I took some pharmaceutical courses, and what I found interesting is that you're really learning brand names.
Brand names, 100%.
Which I was like, whoa, why are we learning brand names in school, right? So that there's a corporate side to it. And I wasn't interested in that. Not that it's always bad. There's a need, but it's not what I wanted to do. Right. I found chiropractic and
it's more holistic.
I went that route.
It's more holistic. What is one thing that you see in, like, when you treat somebody, when you adjust them? What is one big difference that you see them come back to you and tell you?
So let's say someone was to go to see their family doctor for back pain, right? Okay. Before anything else, they're going to make them jump through all the hoops of imaging, right? X-rays, okay, maybe a disc injury, okay, MRI, and then maybe PT at the end. And I'll just tell you right now, all of that's most of the time not even necessary, right? We're known in this country to do excess imaging. A lot of the time, imaging is not necessary, not what you think may be needed. Unless, of course, there's the signs where something's extremely severe. But something as simple as low back pain can have simple causes that, you don't have to jump through all the hoops to get it solved. And that's what's different about chiropractic, right? Whether it's on the first or second visit, you're getting treatment right away. Especially if after the exam, we see it's something that can help you right away. So again, to answer your question, a lot of times there's just a lot of hoops to jump through. to get to the bottom of your solution versus chiropractic. It's pretty immediate. Like when you came in, I think we did an x-ray.
That day, but that day you also automatically already adjusted me and I started feeling better.
Right. So that's what we see a lot too, where it's almost immediate results because it's physical medicine is what I like to say in the office. Not so much chemical medicine, if that's even a right term, but that's what I compare it to. Physical medicine versus, chemical properties.
Right. I took a little bit of pharmacology doing nursing because I studied a little bit. So you're right about that. They don't only go over the brand names. They go a little bit over the mechanism of action of each medication. But I don't like that route either. Like I so much rather the physical aspect because our body has such a great property to heal itself. Right. And we just need to help it heal itself.
Right. And that's actually the foundation of chiropractic. Chiropractic is about really truly like the philosophy of chiropractic is allowing your body to heal itself. We're just removing the interference.
Right.
That's a philosophy. If you go to chiropractic school, they'll teach you some of that. How much you preach it is up to you. But there's some fact to that where the body does have the ability to heal itself. You just have to kind of do the right things to allow it to happen. Other routes like medications, either mask the symptoms or may solve one issue, but then affecting you in other areas negatively, right? Yeah. Side effects.
Yeah. That's the other thing. Like they give you the mechanism of action and then the side effects.
Right.
So then I would see that you would take one pill to treat all these, but then you take a pill to treat the symptoms of that other thing. So it's like, and then that pill has other symptoms that sometimes you needed to take medication for or lower the dose of this.
And then people find themselves in a loop,
it's right? A circle.
They're stuck in this circle. They're stuck in this loop of, well, I'm taking this because I had this problem, but now I have to take this because this drug's giving me this problem and I need to control that. So chiropractic avoids a lot of that, again, because it's more natural, more physical, and the goal is to allow your body to heal itself.
For sure. I got to tell you, after that last adjustment that I did, the one post my injury, the re-aggravation of the injury, I got to tell you, I felt the moment it happened, painful.
I would imagine.
But then after, man, I felt much better. And I feel better now. I know that it's still there. I know that I still have the issue there, but it's getting better. Good. I will tell you, prior in my early in my life, like I had a bad hearing. Like I kept hearing bad things about chiropractic, mainly from my stepdad. My stepdad had a bad experience. And I think like in life with every profession, not every professional is great at their profession. And that may be a reason why he had a bad experience and then that projected into the whole field. I don't think the field is to blame for one bad professional.
Right.
So give me a little bit of background. I know you have to hear that a lot.
Oh, like, all the time. It's a question. Like, So one thing's like fear, right? Or bad experiences. But that's in any profession, right? You go to see anybody. I mean, any business, whether it's medicine. There's bad doctors who overprescribe or surgeons who are, leaving artifacts in the incision or whatever, There's bad actors in every profession. Yes, chiropractic has those as well. But what I always say is don't have your viewpoint based off of one bad apple, right?
Right.
There's others just like, hey, if you go and get a haircut and you get a bad haircut, does that mean all barbers are bad?
No. Of course not.
Right. Absolutely. So that's it. But a lot of it comes from fear as well, right? Especially like the neck adjustment.
Yeah, the crack. Oh,
it looks painful. It looks like it's dangerous, but it's really not. A good point I'd like to make about that usually is based off of malpractice insurance, right?
Yeah.
So we all have malpractice insurance in case we hurt someone or, God forbid, kill someone, right? The more risk you're putting out there, the higher the malpractice insurance would be. Chiropractors pay one of the lowest malpractice insurances of almost any healthcare provider.
Wow.
And insurances don't play. If you're costing them money, they're going to make you pay more.
Of course.
We're not paying a large amount on malpractice because we're not hurting a lot of patients.
Right.
Most of the time, worst side effects can be soreness. That's about it,
Yeah.
arterial dissections, things like that. If you do the right exams, you can avoid all of that. If you see someone who's older, maybe with high blood pressure or have pre-existing conditions, you can avoid that by not doing the chiropractic adjustment.
Right.
So it's all about a good exam, education, and just making sure they're the right patient for chiropractic.
Sure. What would you say is the toughest thing about being a chiropractor?
The toughest thing is probably what we just talked about, fighting the negative stigma towards it, but that comes with years of experience, being able to explain what I just explained to you, and really experiencing it for yourself the first time, right? Like maybe you were nervous about chiropractic. You were going off what your dad experienced, but then you were confident enough to come and, try treatment with myself. I hope you've had a good experience so far, and usually it rolls from there, but the hardest thing is really getting past that first phase of, hey, is this going to hurt me? Is this safe for me? Am I going to end up worse than what I came in with? Right. I usually answer those questions every day with patients, but I feel like I do a good job of making people feel comfortable in the office, not doing anything that may put them in an uncomfortable position. Mm-hmm. And once they're feeling relaxed and familiar with the environment, they usually open up to more therapies.
Okay. So give me something that you do. If you feel like, doing the adjustment, they don't feel comfortable with it. What is something else that you do that alternatively?
Yeah, well, there's actually different techniques to chiropractic. So most of the videos you see and all that is like manual adjustments, right? Hands-on, where you're getting loud pops, loud cracks, whatnot. But we have chiropractic tools that are similar in the mechanism of how they adjust, but just with less force, and that's able to get a good adjustment without feeling painful, without the cracking that a lot of people are afraid of, and usually reduces the chance of soreness. So like the activator, for an example. I don't know if you've seen it, that clicking tool I have. It's a handheld like clicking tool.
Oh, I haven't.
I'll show you at the office, but
I gotta come by and see it.
It's an adjusting tool. So what it does, if I feel a joint that's fixated, not moving well, not moving properly, I can place it right on that joint, provide a few clicks, and that helps improve the movement of the joint without having to use my hands to better improve the movement of the joint.
One of the things that I love is just picturing the human body and the fixated joint. Right. So where exactly is the application that you're doing to the joint? Where in the joint is it?
So most of the adjustment, it happens in the facet joints, which are small joints within the spine that allows the vertebrae to move in certain degrees, different directions, right?
Okay.
So with our hands, we have what's called a line of drive, right? So each joint is, depending on the region of your spine, moves in a different direction. So with our hands, it's not just pushing it, however, and hoping it adjusts. There's a certain direction we need to push the joint to get it to move, to get it to readjust itself. So here, let me break something down. The adjustment. So, okay, let's talk about range of motion, right?
Go ahead.
You're familiar with range of motion. You have passive range of motion, which is, if I were stretching your neck, how far can I stretch it, without pain or discomfort, just a natural stretch.
Correct.
More passive range of motion. Active would be you turning your neck.
You're yourself doing it, yeah.
Now, anytime you move your neck passively or actively, each joint is moving to some degree in that direction, right?
Yeah.
Now, what the adjustment does is allow your joints to move in what's called the physiological joint space. Yeah, so it's basically a range in your range of motion,
right?
That the adjustment helps the vertebrae enter, right? So it's like, let's say active range of motion starts the movement, right? Passive, if I stretch it maybe a little more. The physiological joint space is where the adjustment occurs, where we move it a little further, but it's right before anatomical decay or basically pain and discomfort.
Right. Or the point where the joint's not supposed to go.
Point of destruction. Exactly. Yeah, there's another term. I couldn't think of it.
What do you think causes, or in your opinion, what do you think causes the inhibition of the joint?
That's a great question. This is something I love to discuss in the office because it helps chiropractic make sense, right?
Right.
It's like, why do I need an adjustment? All right. So around your spine, you have collagen, right? Collagen is a type of tissue, right? Now, anytime, let's say sitting for prolonged periods of time, you're adding stress to those joints, and you're microscopically speaking, adding tears to that collagen, and that collagen is what helps your joints move properly, right? Mm-hmm. Now, let's say you do this every day over years at a time. Eventually, you start to develop scar tissue within the joint, right? Because as any other tissue, if you injure a tissue, if you cut yourself or whatnot, it's going to heal as scar tissue. Now, scar tissue is not as mobile, it's not as flexible, it's not as strong as normal tissue. So, to keep the answer short, essentially, if a joint's stuck, it's because the tissues that surround that joint are not allowing it to move properly. So what the adjustment does is help break up some of that tissue, allow your joints to move freely again. And that's where the adjustment comes in. Like for car accidents, for example, right? Like let's say whiplash, a severe whipping of the neck. A lot of the tissues within the neck become overstretched, become torn. Well, the goal of chiropractic care in that scenario is to make sure your joints are moving properly as your tissues heal. So at the end, you have the least amount of scar tissue, the least amount of permanent injury possible, right?
Right.
So that's usually where the fixations occur. It's tissue within the joint not allowing it to move properly. And that's where providing the adjustment helps it move better, helps it free from those tissues, so you can get your joint space back to normal.
Is there like a prescription that you give to your patients to take home, or is everything in office?
No, so we definitely provide home therapies for the most part. Because yes, chiropractic is important. Providing joint motion is important, and that's what the adjustment does. But there is that aspect of stretching. There is that aspect of active care at home that is important. Is that something we do at the office a lot? No, that's not our main concern, but we do know it's a piece of the puzzle to get you better.
For sure.
So we usually send our patients home with some form of therapeutic exercises to help you get better at home.
Okay, so because that's important. You're taking the patient care of from the moment they come in to the moment they leave, so that they have something to continue on doing.
Right. And I feel that's what makes us different from physical therapy, right? If you see a physical therapist, they're going to work with you on those therapeutic exercises. And that's great. That helps a lot of people. Is it the answer to everything? I mean, I'll be honest. I've had patients come in who've seen physical therapists and haven't gotten the results they are expecting or wanted. Right. And maybe they were just missing one piece to that puzzle. So, it's about all the phases of healing, making sure your joints are repairing, but also adding in those therapeutic exercises to build up strength and mobility and get you back to your normal routine.
I see health in this field, the fitness period. It's a combination of everything.
Exactly.
We need the strength trainer. Mm-hmm. We need the physical therapist. We need the chiropractor. We need the doctor that can diagnose certain areas or specifics, right? Because there's different doctors that do like the eye doctor and all that stuff.
Right, every specialty, right.
So you need every specialty to work together. One of the things that bothers me is when one profession is knocking on the other profession just because it doesn't align with their line, right? There's like, oh, these guys, I don't like what they're doing over there.
Right.
And it's like, but we need all these aspects. Because based on what you're saying, you work mainly at the bone level.
Right. At the joint level.
At the joint level. Okay.
Well, yeah, we're best trained at the joint level. Mm-hmm. Now, chiropractic is leaning towards a lot more physical therapy side of things. Like there are a lot of chiropractors who, in their office have a gym and do the PT side of things. But the core root of our education was joint-based, spine-based, really joint-based to get joints moving properly. But back to what you were talking about. Yes, there's no point in knocking other professions. I mean, chiropractic is the leader of that, right? I feel like we get the most knock.
Yeah.
I don't know why. Well,
personal trainers too. I've heard coaches call personal trainers personal terrorists.
Well, they probably had a bad experience with one, and then, like I said earlier, are just putting that experience, are broadening that experience to every physical therapist. But I'll just say back pain, joint pain, really pain in general is a big market. Mm-hmm. There's a lot of competitors, especially
everybody's trying to sell something.
Yeah, exactly. So sometimes, for business, you find yourself knocking others. But at the end of the day, I think that's the worst thing you can do, because then it just shows, hey, you're not confident in what you do and you're worried about others. If you're providing a good service and you're getting people better, the word's going to get out there. You know,
it's unfortunate that professionals think about more making money than actually helping the people that are, you know.
Right. And those people don't usually last too long. You know, I mean, hey, let's not lie here. Everything's a business and we need to, you know, acknowledge that. But patients can see right through that as well. If I was treating just for the money, I probably wouldn't be where I was today. You know,
for sure. Yeah, you care. You have a different care towards the clientele that you have.
Right. And that spreads, and they tell their family, they tell their kids, whatever. And that's how you grow. You know, if you're not caring, you're not growing. I believe that.
Yeah, that's with everything in life. What's your favorite part about being a chiropractor?
My favorite part about being a chiropractor, I would say almost the immediate relief I'm able to provide people, you know. And what's cool is sometimes it's like, as soon as they stand up off the table and they're like, wow, I feel better already. They don't find that in a lot of other places. There's not a lot of other things you can do besides maybe an injection or some type of medicine that can provide immediate relief. But to have it be done naturally brings me a lot of joy, because, man, I'm changing lives, you know. And sometimes I don't really sit back and reflect on that, but there's times where I do, and it's a big deal, you know, because if you can't work, if you can't sleep, if you can't carry your kids, what are you doing? What are you living for? You know?
Yeah.
If you can't bend over or you can't enjoy your hobbies, right? Then what's life about? And sometimes I forget about that, but really that's what it's about.
Yeah.
It's changing people's lives so they sleep better, function better, enjoy their life better, right? Because you're not enjoying life if you're in pain and discomfort. And being able to get people out of that is awesome.
Yeah, it's a huge reward at the end of the day. I mean, it's just seeing somebody come out and be like, wow. Like for me, it's like, man, I couldn't lift that before.
Right.
Like I literally have a client that she can't really bring her heel to her butt.
Okay.
Fully. Like I have her do leg curls and she couldn't do it. The other day, she did it all by herself. And that alone is like only been a month. And it's like, that just, to me, like a lot of people show these, for personal trainers, they have like before and after pictures, all these before and after pictures. Man, I don't care about that. My dad all the time is like, oh, we need to get before and after pictures. Man, I don't care about that. What I care about is the person, how I received her before, her personality changed, or how she felt after she saw me. That's more important to me than a picture showing her body before and after.
Right, right.
But everybody's fixated in the aesthetics and how things look, right?
Right. And that's the thing with chiropractic, there's not a lot of that, right? Because, I mean, pain, you can't tell if someone's in pain.
Sometimes you can.
Yes. So if it's really severe, yes. But there's people out there who have dealt with 5 out of 10, 6 out of 10 pain for years at a time. And that's just become their normal, and they're used to it. And they think they have to live that way unless they get surgery, right? But then they're able to come in, notice some improvements right away, and that really changes their lives.
It's crazy to think how many injuries we are able to really deal with without surgery.
Right. It's a lot. It's most of them.
I would want to go as far as to say as all of them, but obviously there's some that you're like, okay, you definitely need surgery for that.
Right.
But even then, like our bodies are they're so well made, so perfectly made, that I do believe that we're able to heal at every level. You know,
I believe that as well. And again, that's another problem where sometimes people jump to that immediately, right? Mm-hmm. Or you get the recommendation, oh, you have a herniated disc, you need surgery, or you need a nerve ablation to stop the pinching of the nerve or whatever. Mm-hmm. That's not always necessary. Chiropractic helps with a lot of that. Physical therapy helps with a lot of that. Mm-hmm. And yes, you're right. A lot of times solutions can be achieved naturally or without the need of severe surgery. You know?
Yeah, for sure. And in your field, when you have a brand new patient come in, what's your initial assessment look like?
Great question. So they fill out their paperwork, right? That paperwork includes a whole mess of different things, but basically that's to rule out any red flags that are not going to allow me to do chiropractic, right?
Right.
So they fill out their paperwork. After their paperwork, they come on into the office. We sit down, we talk about what they wrote down. We talk about their chief complaint, talk about, how I mentioned how it's affecting their life, because I take that serious. That's, in my opinion, that's why they're here.
For sure.
You're here to get yours back to sleep, get back to work, get back to your hobbies, whatever. So we talk about it. Then I'll do the exam. So the exam includes a few different things: a neurological exam, a range of motion exam, simple, palpation, which is me kind of feeling the spine, seeing where there may be a problem, where there may not be a problem. I'll check the surrounding muscles. That's about it. I keep it pretty simple. That gives me a lot of information. Of course, if I feel there's a need for imaging, need for x-ray, whatnot, I can proceed with that as well. But so after the exam, we'll talk about, hey, your findings. We'll talk about what needs to be done to move forward. And if imaging is a case, hey, I'll send them out for an x-ray, get the report, talk about the findings. And then from there, come up with a game plan to get them better, right?
Right.
And usually the game plan is taking it one day at a time, maybe a few treatments to start, see how you respond with chiropractic, seeing how you respond with care. And then depending on your response to the initial care, we go from there.
Perfect. You said they have to fill out the sign that there's something there in the form that they fill out that won't allow you to do chiropractic. What do you mean by that?
Well, right, like pre-existing conditions that are red flags to me that say we can't do adjustments, right? Severely high blood pressure, not a good idea.
Why?
Right? Well, because usually if you have high blood pressure, you may have arteriosclerosis, you may have plaquing in your arteries, and that is where things can get a little dangerous, especially if you're older. But basically, if those plaques get freed after an adjustment and go to the brain, it can cause a stroke,
right?
Things like that, right? So we need to rule that out, or a possible fracture, obviously, right? If someone's in a car accident and I see that in their history and it happened yesterday and they're coming in today with 10 out of 10 pain and there may be the possibility of a fracture, I'm not going to want to adjust them because obviously that'll make things worse. I would want to do imaging first, see how those results look and go from there.
Oh, okay. Yeah, because definitely you would not want somebody to actually pass away.
Right.
You're doing an adjustment to them.
And people think it happens more often than it does. It really doesn't, That's why a lot of people may be afraid of chiropractic. Oh, he's going to whip my neck and I'm going to die. That doesn't happen at all. If that was happening often, we wouldn't even be
you
a
wouldn't
profession.
even have a job. No,
we wouldn't have a job. The word would be out, don't do chiropractic. We wouldn't
100%.
be covered by insurances, right?
For sure.
You can come with your health insurance and do chiropractic. If we were dangerous to any degree that mattered severely, we wouldn't be reimbursed by insurance companies.
For sure. No, that's something to just wipe your sweat off, especially for somebody listening that's trying to think about doing chiropractic and they were like having that in behind their head. Okay, now I know.
Right. Right. The insurance is not going to approve you to go get this therapy that's going to kill you. Right.
For sure.
So that's just one of the many points. But again, it all depends on your history, what you're dealing with. And from there, we can determine if chiropractic's safe.
For sure. For sure. No, that's awesome. What do you think is the main cause of the bad rap that chiropractors get?
The main cause of why chiropractors get a bad rap?
Yeah.
It probably falls on the fact that there's many chiropractors out there who claim they can help with issues that they don't have the right to claim at all times. Give
me an example.
Okay, like if a patient comes in and in their history they write they've been dealing with stomach pain, just whatever. There may be chiropractors out there who say, well, if the vertebrae in your spine in this specific region is not moving well, by adjusting it, it can improve your stomach problems. Okay. Now, I'll be honest, they're not reaching very far because there is some connection there, right? the nervous system.
The nerve that comes and innervates that area comes from the spine.
Right.
So-
but is it the root cause of all your stomach problems? Most of the time it's not, right? But then that just them saying they could help is a bad look because you're not a specialist in that field. You're a chiropractor, right?
Right.
And it goes back to philosophy on, okay, here's the philosophy. So by correcting your joint motion, it's going to take pressure off the nerves and allow us to remove that nerve interference, which can help with X, Y, and Z.
Yeah.
Because your nerves are what direct the healing process, is what send the messages to your body to heal, to function properly.
For sure.
So by correcting the joints, which, surrounds your spinal cord, surrounds your nerves, it can help with these issues, right?
Yeah.
But then the problem lies, in the medical field, if a chiropractor is claiming to help with heart issues, the cardiologist is going to have a problem with that, right?
For sure. Because it's going to take some of his money away.
Well, right. And he she studied that area much further than the chiropractor did, right? The chiropractor may not be wrong, but it appears to be an improper reach of your specialty.
Yeah, correct. You're stepping out of your zone, is what it's saying.
And I think that's where a lot of the bad rap comes because, there's chiropractors who claim they could help treat cancer, right? And maybe they're onto something, but, at least in my office, I never reach that far. I keep it joint spine related for the most part.
Right.
Because again, then I'm just throwing off the patient. Hey, wait, I came here to get help with my back pain, but you're talking about helping with, my breathing issues. And it kind of is a reach there, but again, it works for a lot of people. And there's chiropractors who help a lot of people with that philosophy. Do I think they're wrong? No, but it is putting this idea out there for many to say what you may be thinking. Hey, chiropractors are wax because they just do adjustments for the spine, but then they're saying it can help with this, So I think that's where the bad rap comes. It's just you focusing on low back pain and not let me rephrase that. Not focusing on spine and joint pain and saying you can help with other things that maybe you're not the best at.
I don't completely disagree with it either because this is what we spoke about earlier. Before me and Jay, there's always a realm where we don't know. Whatever is like, so I heard this somewhere. I remember right now. It's like there's what we know that we don't know, something that we don't know, and then a unknown known.
Okay.
I don't know if that makes sense. It's crazy.
No, I know what you're talking about.
So pretty much there is a place where we don't know that could exist in.
Right. You don't know what you don't know.
Correct.
And yeah, hey, there may be some signs there and some therapies that can help with things that, we're not saying we can help with, but to just outright market that is where things can get weird and maybe brings a bad rap to chiropractic.
Yeah. No, for sure.
I have another one for you. I think our care plans get a bad rap too. I've seen videos or whatever. Hey, you don't need these many treatments, right? I just think the education is not out there on why those treatments are necessary, right? For example, let's say someone was in a car accident 20 years ago, never did treatment. It was pretty severe. As you would imagine, probably a lot of scar tissue in their neck, right? Do you think their neck is going to get better with just 2 or 3 adjustments? No, right. It all depends on the patient's age, how long they've had the issue, and really the severity of the issue that caused it in the first place.
And how well each treatment is received.
Right. How they respond to care. Are they doing their homework as well? Right. So I think that's where a little bit of bad rap comes to. Hey, a chiropractor wants you to come in for three visits a week for a few months.
Right.
right? Yeah, maybe that's excessive for a patient who's healthy, who just, whatever,
Who's perfectly fine, who didn't have the accident.
who didn't have an accident, who had maybe a minor injury at the gym and it's nothing extremely serious.
Right.
Yeah, maybe that's a too deep of a care plan. But for someone who's maybe a little older or had a severe trauma years ago who never got it taken care of,
Right.
there's going to be a lot of changes that have to be made, and changes take time. And that's where these maybe longer care plans come from. And it is necessary for patients dealing with those type of issues, so it all depends on the patient, their history, and how severe, their injury was.
Wow. So it's a lot. It's a lot to take in because there's so much that goes into what's causing the person pain.
Right.
And you are looking at one little piece of the whole picture.
Right.
And it's necessary. I think that, like we said earlier, it's every aspect is necessary. I think that you need to find out if your joints are properly moving, because maybe that is causing you a problem, or you need to check on your nutrition. You need to check on the health of your muscles. How well are you contracting or not contracting your muscles? How well are they activating or not activating? You have to check your internal system. Like, there's every aspect of our health needs to be checked. And I think that we put a bad rap on certain professions because it takes away from us. But
right.
There's so many people in the world. We're not going to be able to see all of them.
Right. Exactly.
What people think that just we're going to run out of people. No, man. We're not going to run out of people. We're not going to run out of injuries. We're not going to run out of like issues in our system. Like the health system, industry and the fitness industry and just in general, it's so broad, and there's so much and there's so many, and there's always going to be more, and there's always going to be something new.
Absolutely.
Is there something new that you think that's in the chiropractic field now compared to before? Is there something that's different that has changed in time?
Something that's changed in time with chiropractic? I would say what I talked about earlier, adding those other therapies, right? Like, let's say when chiropractic started, it was just the adjustment for the most part. It was just doing the adjustment, getting the patient in the office, onto the table, providing the adjustment, and you're out the door.
Okay.
Was that helping a lot of patients? Yes. But times have changed now where, through education, research, whatnot, there is those muscle components. There is those other therapies that have been shown to assist the healing process and help patients get better faster, right?
Right.
So as I mentioned, I think chiropractic is going in that direction, where a little further away from just chiropractic, just the philosophy of get your spine adjusted and everything else falls in place after that, versus now, hey, let's do chiropractic, but let's add in electrical muscle stimulation, right? Or manual therapy, stretches, trigger point therapy, a lot of what you do. You help a lot of my patients, and I know they do well with you. So
sure.
It's about bringing in those other components to give the patient the best experience possible.
For sure. Let me ask you, in your opinion, somebody who's, having their own treatment, their own chiropractor, how can they spot whether that chiropractor is good or not?
That's a great question. Okay, so number one, I would say this is a funny one, but here in Miami, it's relevant. I would say number one, go to an office that's seeing everyday individuals like us here, right? Because there are a lot of offices out there here in Miami specifically that just focus on car accident injuries and focus on personal injury side of things. Chiropractic's necessary for that, but I think a lot of the bad chiropractors come from those markets, right, where they're not helping everyday people who pay out of pocket, use their health insurance, but they're rather just treating patients in car accidents and
because the car insurance pays for
and
it.
Car insurance and attorney side of things. Usually, from my experience, the quality of chiropractor goes down in those fields because it's just a less care. I don't know, but I would say find a doctor that's helping patients who pay out of pocket, who maybe use their health insurance, because what that tells me is they're getting patients who are having to pay, and someone's not going to pay if it's a bad service, right?
Sure.
So that's a good way. Maybe to spot a bad chiropractor, one who doesn't do a thorough exam on the first day, right? Exam is 90% of the problem. You figure out the problem with the history pretty much. So if they're not doing an exam, they don't really know what's going on, and they're likely not going to help you as much as you need.
Right.
That would be the majority of them. Yeah.
What's your opinion on the snap, crack, pop?
Okay, good.
Yeah.
So, I mean, I would consider them more older chiropractic, right? Well, does snap crack do other therapies? Have you ever been to
I went one time. I literally showed up. I filled up the thing, got on the table, pop, pop, done, out of there.
Right.
There was nothing else. There was nothing. There was nothing else.
Yeah.
It was in and out, and the guy didn't even ask me where my pain was or anything. He just crack, crack, done. Okay, here you go. You're done.
My opinion about those, they're helping people, but I think they're more, in the field of maintenance and wellness care.
They're like the fast food restaurant.
Yeah. Yeah. But in the health industry. No, it's about getting in and out, getting your adjustment. Would I go there with
literally in and out?
Yeah. Pretty much.
Man.
I went to the joint one time. I was in a lot of pain. I couldn't see my chiropractor. And I just needed a quick adjustment.
You have a chiropractor yourself?
I do. I have a chiropractor who comes to my office and gets me treated, and I'm due for one right now, actually. I just haven't found the time to see him. He's a little north of here, like by Weston. But
that's amazing.
But here, look, my opinion on those offices is if you have maybe a minor problem or just looking for wellness maintenance care, that's great.
Yeah.
You're going to get an adjustment. You're going to be in and out in a reasonable amount of time, decent prices. Sure. That's great for that. Now, if you're dealing with a more complicated issue or an issue you've had for a long period of time, that wouldn't be my first place to get treatment.
Okay. So if you want a 3-course meal, you go. You want a quick meal.
I mean, hey, and the thing is, at my office, we're pretty quick. We get patients in and out, but we're not just doing adjustments. We have.
I've been there. It's amazing.
We have a great therapist. We have other great therapies we offer, and it's helping the whole scope, right? It's not just the adjustment. The adjustment's helpful, but I feel like adding those other therapies help a lot as well. And that's not what they're doing at Snap Crack or the Joint, those places where you go in, get an adjustment, and get out.
Yeah. It's completely different. It's another. But you do agree that it does help in some way.
It definitely helps. Yeah, it helps, just maybe not as much as it would if you were adding in manual therapy or other therapies that other offices may offer.
Right. Okay, got it. Again, not knocking. I'm knocking that.
No, it's a good question. It's because, hey, they're popular and there's a lot of locations.
Sure.
And I'll be honest, what makes them competitive is their convenience, right? You're in, you're out. Right. You don't take up a lot of time. I try to kind of do some of that as well, because truth is we're all in a hurry. And if you're waiting in the lobby for an hour, you're not going to go back. So that's something I pride myself on. I try to not have patients waiting a long time, because if you have to wait, how often can you see me, right?
For sure.
So that's what they're good at. Hey, you get in, you get out, you get your adjustment.
That's one thing I do love. I go there, and it's as soon as I get there, my appointment's ready, and we get in and we get work and done. Let me ask you, I have sent you some little clips of some crazy chiropractic.
Oh, yeah.
What is the hardest adjustment for you that you think doing to somebody?
The hardest adjustment, what took me the longest to master, and not that I'm a master now, but I've taken my strides in the right direction, is the low back adjustment. The low back, it's
which one? The SI joint?
The side adjustment, where you're laying on your side. You kind of have one leg bent, the other one straight. It takes, because it's a whole body movement, right? It's not just pushing with my hand. No, my torso's involved. Kind of dropping my hip. There's an art to it, and that's actually something they teach in chiropractic school too, where there is the art component of chiropractic. It's science, art, and philosophy. It's kind of what makes up the triangle.
Right.
You need to have the science down to know how you're going to help patients. You need to be able to perform the art, which is the adjustment, right?
Right.
That's a skill in itself. Like, we had classes where it was just learning the adjustment, right? Like set up, like we would literally hold positions and like the teacher or professor would come around and like, hey, no, you need to raise your elbow a little higher, or you don't have your shoulder into it, or whatever, you know, you have the wrong line of drive or whatever. So it's about the art, and mastering the art is pretty tough. You know, when I first got to chiropractic school, we started real simple, just feeling spines, right? On other classmates, practicing on each other. And at first I'm like, man, I don't feel anything. What's going on? How am I going to do this? I don't feel anything. But with time.
You probably had a healthy body.
I mean, we're all healthy individuals, but I mean, no, with time,
you still started feeling.
You start to feel joint fixations, right? And that's what it is. Like when you come to the office and I'm checking your spine, I can feel where the resistance is. I can feel where maybe your joint's not turning properly, which direction it is turning properly, not turning properly. And that comes with time. And that again is an art. So, I mean, going back to your question, that was probably one of them too. Being able to feel the joint fixations, because that's a big part of chiropractic. Without your fingers and without, you know, sensation, you really can't do chiropractic.
No, for sure.
So that was a struggle. But then to answer your question, the adjustment, probably the low back one, because it's a whole body motion and it's more than just my hands.
Now, which one scares you the most to be done on you?
On me?
Yeah, because I can tell you mine is that hip one. That hip one.
I've never really needed that one, so I couldn't tell you. The scariest one for me, I mean, of course I would say the neck, because it's just, right, it's by your brain. You're a little freaked out, especially if you're with someone you don't trust.
Right.
That can be the scariest, because, hey, he's not, I'm not scared that I'm going to get killed, but can I walk away sore? Can I walk away feeling worse than what I came in with? Yes, if the chiropractor doesn't know what he or she's doing. And then, the neck is just more sensitive than maybe the mid back or low back. So I would say the neck adjustment. Haven't really gotten too creative with any other adjustments. No. But that would be the one. Yeah.
You have like a set that you stick to, that the other ones that you usually treat mainly, right?
Repeat that?
Like you have like a set of
adjustments
that you stick to, that you're like, okay, these other ones are the main adjustments that I know that it applies to the whole gander.
Right. So so in chiropractic, there's different techniques, right? Like I can adjust your neck in different techniques. I prefer them done face down on the table. I feel like the patient's more relaxed and we can get a good neck adjustment there. You've probably seen videos where laying on your back and they're kind of holding your head and adjusted that way. Yeah. Or seated and done with a seated adjustment.
Or the one that they grab you on your back and they're like,
yeah. There's a lot. And I've seen a zillion, right? Yeah. I think even people are making up their own. And hey, if it works, good for them.
At this point, yeah.
That's
talking about, people making up their own cracking. Why shouldn't they do that on their own?
Like crack their own joints?
Crack their own joints, yeah.
Yeah, or someone who's untrained.
Like, when people go like, oh, hold me there and crack my back. Plack.
Okay, I mean, I'll be honest. Not all of them are going to hurt you.
No,
like
for sure.
The one you just went over, I don't think anyone's going to get severely hurt with that.
Okay.
But the main problem is a lot of times whoever's trying to adjust your spine, or if you're trying to adjust your spine yourself, 99% of the time, you're probably not targeting the joint that needs the adjustment, right?
Oh, okay.
You can get other joints to adjust.
Right.
Maybe they'll sound, maybe it'll even feel better temporarily for half an hour, right? But the chances that person or you yourself are adjusting the joint that needs the movement is slim.
For sure.
And usually the pain can come back within half an hour. And really the damage that can be done is you're stretching tissues, you're stretching joint tissue specifically, that shouldn't be stretched, that doesn't need to be stretched. And over time, that can lead to some long-term instability issues. Yeah. Like what I've seen, people that adjust their necks a lot, twist their neck, turn.
I do it a lot. I constantly go like crack, and I feel the cracks.
And it's almost like a cycle where you do it and then you want to do it more, and then you're doing it every hour and then every half hour. And it's a cycle that, from what I've seen, gets worse and worse and never really solves the problem.
Yeah, I don't even know what it is. It's just kind of like I feel like I get this little thing here, and I'm like, crack, and it feels better after I do it.
Right. But then how soon after do you feel like you need that again?
Like 3 hours later, 4 hours.
3 hours. Okay,
later.
right. And maybe you keep on, you might be down to
Like
2
right now, I
hours
just
and
did
then
it
1
like
hour.
4 times.
Right.
With aware of it.
With a professional, you know, usually they last longer and
Right.
they target the areas that need it the most.
Professionals last long.
Yeah.
Oh,
Have you
God.
feeling better? There you
Right,
go. That's another
we're
one.
gonna end there on that note.
Add a little joke into it.
Oh, I had fun, man. I love. Thank you
that's a
so
good
much
one,
for
man.
coming by.
No,
I
I'm
really
happy you
appreciate
invited me, and
for
I'm
sure.
happy you got this going on. And
Oh yeah,
you're always doing good stuff, man. I'm happy for you.
yeah. No, I'm trying. Moving forward, that's all we have to do in life, right?
Yep.
And helping one another. That's all
That's
we're here
it. Yes,
for.
and I'll be happy to do this
I
again
appreciate
anytime,
you.
man.
Oh hell yeah, we're gonna have to have a comeback on this. Thank you everybody for watching. Have a great day.